the oral health community and the oral health research community has truly come together, and it is actually unprecedented, and it's the first time that we have a document that everyone is in agreement with and has endorsed.
They had academics, they had healthcare professionals, they have scientists, they have funding people, they are government officials, and brought all these communities together for one purpose, that is to improve oral health.
All the stars have aligned. Now you have the research strategy, you have the dental care program going on, you have more information available, all these surveys and funding to gather information. It's just a unique and brilliant time for oral health in Canada.
C'est vraiment une opportunité de pouvoir répondre aux besoins de la société.
This is a moment in oral health and oral health care that's really important. And that we have to seize that moment. All of us, we have to get involved and we have to move forward with dental care and help to change things for the better for the oral health of Canadians.
It's a strategy. It's not a strategic plan. We want this document to move forward and not just be another report.
I think the major thing is we need to raise awareness about the strategy. Researchers need to be aware of what's out there and what they should focus on.
I see the research strategy being not just like a framework or guidance for people who do research, but I actually see it as a bit of an advocacy piece as well. And I think later on down the road, it will also play into policy and how policy becomes developed based on what the research finds.
I think that this initiative is important for us to have focus. What is important here for the Canadian population from 2026 to 2035 as described in the document.
We have been discussing how inequalities in oral health is one of the big issues globally. So I was really happy to see this equity lens into the whole strategy.
We had a person who was deaf bring their perspectives. We also had people talk about other accessibility needs, such as people who are wheelchair users. I was really pleased that we got to hear some of those perspectives.
That notion of how do we invest in looking at more environmentally sustainable products, things that are used, and what's our impact in the world. So that really stood out to me, as well as the whole investment in AI. AI now is just exploded, and we see real impacts on clinical practice, on the information that's available.
Je suis très heureuse que la mobilisation des connaissances, dans cette dimension, mobilisation des connaissances et sciences de la mise en œuvre, soit reconnue comme une priorité au niveau de la stratégie de recherche en santé bucco-dentaire.
This will definitely have ramifications internationally.
Sets a very good example and quite high level for other countries to catch up and develop their own strategies.
I think we all start somewhere, and just the fact that this initiative has been launched, we start today.